IVF is a technology which is a boon to many childless couple. But unfortunately, எல்லா டைமும் IVF first timeல successfully இருக்கிறதில்ல. So what can you do from your side to make it successful at the very first time? I am Dr. Niveditha Amilthan, fertility consultant from the High Fertility Clinic. Generally, an IVF success depends on the age of the women undergoing the IVF, அவங்களோட எக்கோட நம்பர் அண்ட் குவாலிட்டி, and also the sperm quality, and how good are the embryos which they get out of the IVF cycle. After this, there are other factors which add to the success, like once we transfer the embryo and the embryo correctly implant ஆகணும், and you should maintain a healthy weight around the time of embryo transfer, and also very important in the embryo grow ஆகிற lab conditions, அதாவது IVF labோட standards எப்படி maintain பண்றாங்க, how much is the air quality level maintained, and how are the equipments maintained in the IVF lab, and last but not the least, the doctor providing the IVF treatment to you. உங்களுக்கு எந்த அளவுக்கு அவங்க ஒரு clarity கொடுக்குறாங்க, and how transparent your procedure is explained to you. இது எல்லாம் combined தான் will improve the IVF success. So let us go step by step. First, age. ஜென்ரலாக நீங்கள் ப்ரெக்னென்சி பிளான் பண்ணுறீங்க அப்படின்னா as far as possible don't try to postpone it, and முடிஞ்ச வரைக்கும் young ஏஜில் when we undergo the IVF cycle we can have good chances. For example, at the age of 25 to 30 there is a 60 to 70% chance of getting pregnant in the first IVF cycle. அதே 40-45ல நம்ம IVF பண்ணும்போது there is only a 20% chance of getting pregnant. If at all you feel like postponing your pregnancy அப்படின்னா there are options like egg freezing or embryo freezing which you can avail, so that the quality of the eggs and embryos are very good when they are taken from a young age mother. Second, maintaining a healthy diet is very important for the embryo transfer, especially BMI more than 35 illa less than 19 இருக்கும்போது there are more chances that the first time IVF might not fail. If you fall in this category, make sure you attain a healthy weight before you have your embryos transferred. And third, most of the centers don't give so much importance to the male person or the sperm factor. Giving importance to the sperm and trying to identify sperm factor problems and using the appropriate methods to choose the sperm can improve the success to a great extent. And talk to your doctor on the number of embryos you've got, what are the qualities of embryo, and choosing the best embryo for transfer will greatly improve the success of a first time IVF cycle. And like I already mentioned, talk to your doctor on the success rate of the center, and also miscarriage rate அந்த particular centerக்கு எவ்வளோ இருக்கு அப்படின்றத நீங்கள் தெரிஞ்சுக்கிறது will help you to plan the treatment and get a clear picture of what an IVF cycle is and what you should expect. Despite all these things, if your IVF is not successful at the first time, please understand that this is not the end of the treatment. IVF தாண்டி there are a lot of advanced techniques which can help you get pregnant in the subsequent cycles. So make sure you discuss with your doctor what went wrong and how to modify it in the future cycles.